are still more than 1,000 cases of COVID-19 reported every day in Wisconsin on average, but the numbers prove promising in comparison to just a few weeks ago. Joining us now is Dr. Jeff Potoff, UW Health Chief Quality Officer. Let's talk specifically here about Milwaukee County. That dropped from high transmission to medium transmission within the last week or so, per the CDC determined levels. Seems like we're kind of headed in the right direction once again. What are your thoughts on that?
Yeah, I agree with you, Stephanie. This is good news. So there's really two factors that go into that CDC community transmission. It's both the number of cases, which would be decreasing a little bit to get in yellow. It also says that your health system's doing okay, that you have available hospital beds and staff to take care of patients should they get COVID. So all in all, we're not green yet, but yellow is certainly better than red.
I think a lot of people forget about that other aspect of it. It's not just the testing, it's also actually the hospital capacity and what they're able to handle at any given moment. How are you guys faring in terms of UW Health out there in Madison with the ICU beds and everything?
It's been pretty consistent as far as our COVID numbers go. The hospitals are still really full. I think, one of the things we maybe didn't completely anticipate is how busy we would be coming out of COVID with people who don't necessarily have COVID, but are sick for other reasons. So hospital very busy, but COVID volume very manageable.
There seems to be kind of a new wave when it comes to the vaccine front. Pfizer and Moderna both coming out with talks of a variant-specific vaccine. Could that be ready for the fall, the new school season?
I think maybe this is a tricky one. These companies need to thread the needle. So you would really like to have a variant-specific vaccine that targets the variant that's most common when those vaccines are ready, say early this fall before kids go to school. But if you guess wrong or you get too specific on one variant and then you find out that that variant is no longer the dominant variant, that vaccine might not be that effective. But there's some good data coming out of both Pfizer and Moderna that their hybrid vaccine, which kind of has like a general protection plus some specific Omicron strains in there, is more effective than what we've seen before. So I think that would be welcome news for all of us if we had to get boosted this fall against COVID-19.
And I'm assuming plans are already being discussed as for what to expect this fall, the best plan of attack for the cold, flu, and maybe even now COVID season. Is that the case?
Yeah, so we're kind of taking it as a whole picture of upper respiratory tract infections. It's likely that COVID-19, along with other respiratory viruses like influenza, will have an uptick in the fall, both because that's their normal season, also because a lot of the natural immunity that folks had from recent infections could be waning. So trying to figure out a really good vaccination strategy to give the community the much protection as possible as they go into those winter months.
And I know that there had been talk very early on about potentially, coupling the COVID vaccine with the flu vaccine to make it one shot, to make it easier for parents and people. We're not to that point, right?
We're not yet. Like that would be, who wouldn't want that, right? Like an all-in-one shot where you just have to go get one and you'd be good to go. Someday we might get there. I'm not hearing a lot of talk about that being available for this fall.
All right. Yeah, one poke's always better than the three. That's for sure. I'll tell you that. All right, Dr. Jeff Potoff, we always appreciate your insight.
Thank you.